Okay, yes, I read your comments, but I must admit I wasn't ready. The last video I did was about the aesthetic FDA warning, but I was absolutely shocked, blown away by the number of people that have been harmed by aesthetic treatments overall, and especially the RF microneedling we talked about on that video. Some of the comments were smoother than retinol, but others were rougher than deep chemical peel, and I'm addressing them today rapid fire style. That's called real learning, when we dive into your questions and pain points, and your skin will be the benefactor. Some people were clearly harmed, other people were unsure if they were harmed, and some people were mixing derma rolling, microneedling, lasers, and at-home devices, in my opinion, erroneously. And I'll address that too. Don't shoot the messenger here. And people getting great results, they had no idea why they were. And of course, a few of the comments were spicy, to say the least. So if you're using skincare, home devices, in-clinic treatments, or any form of microneedling, today's video is a must watch. And yes, I've had RF microneedling on my face, and I've performed thousands of the procedures. In that last video, you saw the dermatologist using a Silfirm RF microneedling device did over 21,000 procedures in a year alone and does over 1,000 of them in a month. So please don't shoot the messenger. These are my answers to your side effect questions, and I'm providing solutions. Let's dive into the comments. Your time is valuable. Okay, remember, rapid fire. So here's a comment. Yes, my husband did this on my insistence, aged him, and added wrinkles after he endured a lot of pain. Men are a little more sensitive to pain, and these can be painful. She goes on to say, I felt terrible. I had a great result. It's taken a few years to get his skin to rebound. Okay, number one here is just because you got a great result means nothing for the next person. We're all different, and people think my neighbor got it done, so it's going to be great for me. Has nothing to do with that. It's all about the consult. It's about what the provider sees in your face and what's best for you. So you can't take a procedure on a recommendation of someone else. The other part about this is a good point is she says, it took a few years for skin to rebound. Now for a male, that can happen. I'm going to address a female down the road here. But yes, it typically gets better over time. And there's things, of course, you can do to speed it up. Next one here, Thermage in Asia. Most of the machines are made in 2017. Is that old? Okay. I started Thermage devices back in 2008. Upgraded them over time. I do not use Thermage anymore. I'm in Asia right now, and they use a ton of old Thermage machines. They've upgraded them. Thermage is monopolar. So they're going to put a pad on your back. The electricity goes from the face through to the back. Think about where that power is going. I like Thermage in the right patients. About 40% of people, listen to this, 40% of people, and you're going to pay about $3,000 to $5,000 in proper hands. So in good, someone with good technical skills going to charge that. They're not, that's what it costs. The tips of the device cost money. 40% of people will get a nice result. So if you're happy with that chance, then it's worth it. Here she goes on to say, and this you can see who these people are. RCUD4QO. Okay. I'm surprised about the threading, and I wonder if they have a different technique. As I know where I'm from, Canada, love it. The technique isn't so good. Okay, exactly. Smooth and twist threads need to go just underneath the skin. And I have slides on collagen production if you use those techniques. Barb and lifting threads, they're great, but only about 30% of people are a great candidate, and about 20% of providers are good at doing them. So you have to know who you see. Okay, next question. Here's an absolutely interesting comment. Because I couldn't afford them, I got a modest home RF device, and within 4 months, I developed early jowls. Can't imagine what a more professional treatment would have done. So this statement I'm going to call wrong. What do I mean by that? It's the opposite of what my message was meant to be. So she got a home device, and within 4 months developed early jowls. The problem is the home device has erratic energy. The professional device costs $100,000 for a reason. Now maybe you could say should cost $25,000, but if you get a device for $4, $5, or $8,000, it sucks. And the energy delivery we know is erratic. It's like getting a bad Wi-Fi connection. It could be good at 1 second, and then you go suck some energy out of it. It falls down to 2 megabits per second from 20. It's poor. So this statement is the exact wrong message that my whole video is trying to give. Because I couldn't afford them, I got a home device. If you can't afford it, you can't do it. Something as aggressive as this. And can't imagine what a more professional treatment would have done. The more professional treatment, you got way higher of a chance of getting a better look. And imagine for this person, they treated one face with an aggressive RF microneedling device, because just because it's cheap doesn't mean it's not aggressive. And it was the first face you've ever treated. Do you want to be the first face I've ever treated? Probably not. You want to be the 1,000th? Absolutely. You treated your first face. Not good. You need to see this one too. So I recently got a different perspective that I didn't expect. I know 3 women who really changed the way they looked after they found out their spouse was cheating. 2 had cosmetic procedures, 1 really hit the gym, recently found out all 3 did it because they were afraid people would be judging them, thinking, no wonder he cheated. Look at her. This broke my heart a little. 2 of them are close friends and wonderful people. Please be careful getting services out there. The worst time to get them and make snap decisions is when emotions are high. You get one face, and yes, this does cost money, unfortunately. Let's move on. What about RF for the body? For example, saggy skin on the abdomen after childbirth. That's a good use, and you don't have to worry about fat loss, because a lot of people using radio frequency on the body, they don't care. They're trying to get rid of body fat. So people with less experience can run that device. Here it is. I've had great luck. Luck. You don't want to leave your face to luck, but she says this. I've had great luck with RF microneedling. The key is the depth of the needles, and the Korean doctor Min in my original interview talked about the depth of the needles. Every time I've gone, my skin glows for months and I get so many compliments. Do you see how one person had RF microneedling, loved it, probably had a great provider, and she knows the depth and the energy is key. And the energy you use here for your jowl is way different than the energy used in your under eyes. Okay, so that's another great question. Is the NUA device now considered bad? Okay, NUA device is for at home, and I advise everyone to get your at home med spa going. Start building it up. It's going to save you a ton of money from going into med spas and leaving your face to risk by not knowing who's doing it. But also, your med spa treatments are going to be way better if you do home maintenance correctly. The NUA device is safe because it has a built-in safety mechanism. It shuts off at 42 degrees Celsius, above which, at the duration long enough, you're going to lose your face fat. What's an RF microneedling device go to in heat? Above 60 degrees Celsius. My particular device can go above 67 degrees Celsius, and that's going to sear your fat. So the NUA device is safe. Okay, is microneedling similar to thermage? No. RF microneedling, the needles go into the face. They're bipolar, so the energy jumps from needle to needle. Thermage and other ones like that are monopolar RF. So the device, by nature, the energy is going to go deeper into your skin. Thermage and Ulthera. So people performing those have a higher risk of fat loss. And if you heard my interview with Dr. Min from Korea, she mentioned she uses RF monopolar and ultrasound like Ulthera, or what's called HIFU, high intensity focused ultrasound, to target fat.
We do a lot of procedures together. We combine with HIFU, and we also combine with monopolar RF, and we also do combine with a lot of skin boosters. And so we almost do like all of procedures together in one day.
I personally use RF microneedling to target fat, but ultrasound and thermage RF, those type of monopolar RF, are better at targeting and killing fat because they're monopolar. Okay, why would I expect these devices to be safe or effective? I wouldn't put my head in a microwave oven or a mobile phone to my head I don't like to do that either. I use these cheap cords. Read your safety instructions buried deep in your phones. Okay, understand this. This is such an important point. Any device or procedure producing a nice facial result often is going to create inflammation. Even LED masks, as mild as they are, they create a degree of inflammation, and that starts your healing cascade. These aren't like microwaves in that sense. The energy is way different. So RF microneedling, Sculptra, even fillers to a degree, Guri, PCL, any biostimulators, PRF, they all produce a degree of wound healing response. And we want that to be a controlled response. So some of these comments, yeah, it's very different. And I don't want to say they're uneducated. People are very educated, and sure, microwave energy is along the same lines, but the frequency and the intensity is way different from a cell phone to thermage. Okay. In Korea, doctors conduct these procedures. In America, anyone who got a few hours of training, big difference, huge difference, she says. Exactly. People, the demand in the United States for aesthetic procedures outpaces by far the trained providers. And it's money driven. So the quicker you can get a technician up to doing these, the better. Keep in mind, in a lot of Europe, only doctors, not even nurses, can provide a lot of these treatments. In Asia, only doctors, take Korea, can provide these treatments. Not saying the doctor's some god or above anything, but by nature, when you go to medical school, I'm more frightened of things than I feel safe with things. When I see someone stumble on the street, I think stroke. I don't think an elevation in the sidewalk. When someone has a headache, I think aneurysm. I don't think hungover. So when having a experienced person do the treatment is important. Here it is. My friend got serious nerve damage. She still has horrible side effects. Absolutely. When you fry things, have the ability to fry things, the nerves in the face, if you take a facelift like a SMAS facelift or a deep plane facelift, which is these are misnomers, but they're tags now, you're going into the nerve layers below the SMAS. And of course, what do we know targets the SMAS forever since it was developed is something called Ulthera. So there are people, and Ulthera is a built-in ultrasound so you can see depths, but people say they got an element of nerve damage. Now, 99.9% of the time it comes back. This friend, we don't know how long it was, but can nerve damage happen with these? Absolutely. And that's why with Silfirm and with a lot of these devices, the energy, duration, and depth are key. Here was one. I also got damage from an at-home device. I did not feel anything and passed the machine for seconds. So that means she went for a pulse duration of seconds, so a long time of heat. It melted my facial fat for 20 days in a row until I became unrecognizable. Terrible. It was a terrifying experience. When you're going through these things, it's terrifying. So when you get fake fillers or Botox that's fake, you don't know because you went to get it for cheap, under $10 a unit, you're scared to death when it goes wrong. And you can get a home device. It sounds great. Oh yeah, people online, Facebook groups show you how to do it. When you have a side effect and you're now drooping the side of your face like this, you're scared to death. It's terrible. And no one wants to help you. If I go help someone like that, my license is at risk for helping you. That's the problem. It's been almost 10 years since then. 10 years. Terrible. And I recovered 50% of the fat, but still far from where I was. Devastating. Please stay away from any heat or radio frequency devices. They're all risky. So that end of the comment, she's emotional, he's emotional. That's end of the comment I have to tell you is not true because heating is a staple of what it works in aesthetics, and it works. The key is the device, the depth, the duration of energy, and seeing a great provider. Great providers, by the way, are going to charge a lot of money. A lot of facelifts now are $100 to $250. You're even nearing $350,000. You're paying for what? There's no expense in a facelift. A facelift is a scalpel and an anesthesia fee of a couple $1,000s. The surgeon's charging $200,000 for their skill set, right? So anyone who's doing a good RF microneedling device, not charging you, I'm not charging $1,000, I'm charging $2,500. I'm charging $4,000 because the demand is there, because I'm ultimately more worried about your safety or as worried as you are. Sometimes I'm way more worried about the patient's safety. They're flippant and I'm like, hold on here. But that's what you're paying for. I've had 4 of these. So as people will do a series of 4. You go into a med spa, they're going to say, they're going to sell you a package of 4. I've had 4 of these RF microneedling procedures with an amazing technician. But she's an experienced RN, registered nurse, who has been doing these for years. The results have been amazing. No fat loss, but got lots of collagen gained. It's just finding the right place to get this done. That's it. So the prior person lost half her facial fat, was devastated for over 10 years, only got half of it back. And here's a person who got great results. So again, this makes my point. Same thing happened to me. I tried HIFU, high intensity focused ultrasound, RF, many times. Now I have lost so much fat in my face, one side of my face more than the other. I'm hoping sometime soon I can do threads and Sculptra. So your antidote for this, yes, the baby face is in. So superficial, smooth, and twist threads can work great. It's going to be subtle. PRF, plasma fill, plasma sculpt, PRF and Sculptra, great combination. Those are going to be your best studied ways, and PRF is probably going to be your number 1 all natural way to restore this end time and hormones. There's a hormone one coming up. I believe I put it here, and it's really important. Fat pads can also atrophy with just 1 session of Ultherapy. True. At 59, I had 1, and after 3 months, my cheeks were sunken and my neck was full of wrinkles, and I developed, she says jaws, I know she means jowls. This is absolutely 1 session is all it takes. I end up having a face and neck lift at 63. Okay, so you see that. Now, here's the problem. Let's have this tough discussion. This is someone who had it done at 59. She had 1, and then it went downhill. Here's what potentially could be, and this is with so many comments. Something we call concomitant factors, or factors that are coincidental at the same time. At 59, maybe she held her estrogen up to 55. By 59 now you're getting osteoporosis, also of the face. So it may not have been the Ultherapy, and as you guys know, estrogen goes, it drops off a cliff, and it's a devastating time. Sleep, fat pads in the face, bone loss. So it could be that it wasn't the Ultherapy at all, but she's associating it with that because 60 and 63 is she had the facelift. It's the most common time people who never get RF microneedling, never get Ultherapy, never get thermage or anything, and they get a facelift at 63 because they just can't take it anymore. She may have had the Ulthera. Why? Because she's seeing changes due to estrogen and bone loss. And coincidentally, she would have looked the same whether she had the Ultherapy or not. We don't know. You can't study this. Do you see the problem? Because you can't study it, you rely on people like me. People working in real life, traveling the world, seeing real patients. And when you see 1,000 patients, you know. But if you this is N equals 1, a study of 1 person, we can't say. So understand, follow real people who do the things that you're trying to do. You'd never go get heart surgery from a guy who did 5 of them. You want someone who did 500 of them. You get my point. Here it says down here too, he's talking about RF microneedling and not derma rolling for those who want to save a few minutes up front. So what they're saying is, didn't come out in the video long enough. These are the spicy comments. The video went on too long before me saying RF microneedling, but in the cover slide, I gave it away right away. I showed RF microneedling. So people try and hit you. I get nasty stuff all the time. I don't take this as nasty, but you get the flavor. If you want to save a few minutes up front, I get it. Everyone thinks they can be a YouTuber, and when you go get 100,000 views on a video, come back and tell me, because it's very tough world. This comment here is important. Ready? I'm an esthetician, and the wellness spa I work at, over a year ago, we hired a medical esty, that's an esthetician, who did RF microneedling. I'm not in favor of most estheticians doing this unless they have a passion, they work hard, and they really study their art. My boss got her all the machines she wanted, so typical, but before they could really hit the ground running, she ended up quitting. Estheticians quit every month to 3. You're rarely ever going to see the same one twice nowadays. 20 years ago, you could hire them all day long. They loved it. Now, most of them become influencers, and they're like, why would I ever treat a face and make $20 an hour and have people complain to me about their acne in their face when I could make a YouTube video and make thousands. Okay, so we got rid of the machines. Before she left, she did one RF microneedling on me, probably the first one she'd ever done. This was before I knew all this info about how it melts the fat. It didn't do any damage to my face, thank God. I think she doesn't use the heat up high enough, but I'm glad that my boss got rid of the machines instead of having me do them, because I don't want to be responsible for that. Now, I'll come back to that. She did replace it with a microneedling pen that's just the needles, no RF or any other kind of heat, so I was trained on that. I appreciate her commenting. How smart is she? I don't want to be responsible for that. Here's the problem in the world of med spas, you guys. Nobody wants to be responsible. Ultimately, I'm responsible for everything, including this video. And there's going to be haters and people that hate that I put this video up, people that hate me, and they're going to say bad things and write bad reviews because they can't be successful on their own. She doesn't want to be responsible. She's saying it up front. The problem is too many people are working in med spas. They don't want to be responsible, and they're just there for a job. This isn't just a job. You get one face. So hats off to you. And the fact that the esthetician got all the machines she wanted, everything she wanted, and left, it's terrible in the industry. There are very few real workers these days. It's comment below. Tell me I'm wrong here, but it's distressing to me that we're at that point. Till robots come, you got to be very safe. Okay, here's an important one. Ruined my face with one treatment about 8 years ago. Got progressively worse. At 61 now, I look much older. Of course, the spa insisted it wasn't their treatment, their fault, right? So this person, go back here and put the math backwards. So at 53 years old, this person had this done. She's now 61 and looks much older. From 53 to 61, you're going to look much older. Is it the spa's fault? It might be, but you'll never know, because the fact is that at 53-ish, your estrogen's going down. You're starting to look way older than when you were 33 to 41. You're going to look way older now at 61. For those 8 years are much different than the prior years. And so a spa's not going to take responsibility for that. Probably your hormones are pummeling down, loss of bone loss, the zygomatic bone, beauty, youth, and fertility. The bone gets small, the face sags. Most people get a facelift at 61 if they care how they look. So it could have been the device, but you'll never know again. And of course, the spa, well, 8 years later, there's so many factors involved. Sun, drinking, food, but just 8 years at that age would do it. 20 people replied to that. Go look at the replies. Again, my videos might be great, okay, great, but your comments are better, and you're learning from each other in the comments. Makes me more excited than me making a video. I'm facilitating. So at first I thought it was about Ozempic to lose weight. Now people already talk about Ozempic face. Companies are making huge money off of Ozempic because Ozempic face. If you get Ozempic, of course, you get rapid volume loss in the face, and people just look older. RF microneedling can help, but you got to revolumize the face. That's biostimulators, Plasma Sculpt, Sculptra, PRF, Plasma Fill. Okay, next one. Ladies, leave your body alone. How many of these women who actually get these treatments can say their whole life has changed after taking a chance with treatments? Stop it. You'll never be 25 again. Just be healthy and love yourself. Okay, this is a good comment because this is a tough one. You want to live your best life. The reality is when you feel great at 55 or 60, but you look 55, 60, or 70, your life is different. Your opportunities decline. Your opportunity for work declines. Your dating life is way harder if you look 55 or 60 than if you look 35, 40, 45, or just have glow, less brown spots, a little bit of lip volume, a bit of cheek lifted. So to say just be healthy and love yourself, it's great depending on where you live or the circles you run in. For people that are watching my channel, they don't want that. So it's not about avoiding them, because you can get phenomenal results and look 10 or 20 years younger without surgery if you choose. And you may want surgery down the road if you want to live like that into your 60s, 70s, and 80s. But it's not that simple, and it doesn't have to be that way. You just have to know who you see and know the treatments you get. This is another great one. Sometimes it's a good thing if you're unable to afford these professional treatments, meaning the fact that you can't get a treatment means you can't be harmed. Take your point very well. I do like it. I get it. But here's my response. You'll need professional treatment at some point. So it's best to find an honest provider, not motivated by money and with a passion for his or her art. So to say that you never get a face treatment, you would like one because you're going to look better. You're going to feel better about yourself. You're going to get rid of sunspots that maybe could become cancers. You're going to lift some sag. You're going to get rid of that jowl that bothers you, tighten the neck. Who wouldn't want that? Because your life improves, your job improves, your social life improves. You walk in the door, there's just a fact that more people want to invite you out to dinner. Same two things being equal about a person, their mentation, how smart they are, intelligent the conversation. The people who look more aesthetically pleasing than those who don't, and who gets invited to the after parties. All those things. I mean, that might not be important to you, but in our world of what I do, it is. So I hope that helps. Comment below. Tell me where I'm right, where I'm wrong. Now you'll want to watch this video up here on how to maintain and restore your fat pads in case you've lost your facial fat. Keep your skin and body beautiful, healthy, and vibrant. I'll keep giving you the best from around the world. Make it an amazing day.